Many people have become fairly familiar with the Right to Die with Dignity Act. Over the past few months, this act has reached headlines again due to Brittany Maynard, a young terminally ill woman who chose to end her life on November 1st, 2014. While many feel that it is his or her own choice to do such, I disagree, and this is the reason why. As many don't know, I have seen the face of death many times, would have flinched at birth. I was born 16 weeks early, weighing in at 1 pound 14 ounces with no chance of survival. My mother, who was 19 at the time, had one of two options: to hope I make it or to let me pass on. Of course, my story wasn't exactly like the Brittany Maynard story, but my point is that miracles do happen. If my mother would have called it quits, I wouldn't be where I am today. In another case, my grandfather was faced with death. Not only was he on life support for 17 days, but had a massive heart attack and a medically induced coma, blood clots to the lungs, and several other serious medical problems. The doctors told us to let him go, that he wouldn't make it out of the hospital alive, but we told them to do everything possible. Fast forward 2 months, and now he's eating on his own, walking with little assistance, and back to doing the activities he used to before his accident. He's regaining his strength each and every day. People make it through unexplainable situations daily. I believe everything happens for a reason. However, I do not see it fit to end your life. As myself being a woman of God, I believe that he could perform miracles that we cannot explain. I've seen with my own eyes people that should have died with no explanation how they pulled through, the bad and the ugly. I also believe that God will let you pass when it's your time, not earlier. Not even tying religion into the situation, a reasonable person in any society would want to live. Why would you want to say goodbye to your loved ones instead of trying to hold on? I understand the pain and suffering that comes with terminally ill patients, but I could not wrap my mind around the thought of wanting to end my life so soon. If I was in that position today, I would want to spend time with my loved ones and live the rest of my life to the fullest. Many choose suicide in most cases as the easy way out, a way to end the pain, but does it really? Your family will have to carry on the rest of their lives wishing for one more day with you and wishing you would have changed your mind. You're not only affecting yourself, but everyone else around you. It's a scary time being told you only have a short period left, but that's when you should want to embrace your life most, not end it to get the easy way out. As stated by the Family Research Council, disabling diseases and injuries, including those for which there is a terminal diagnosis, are tragic. However, there is no such thing as a life not worth living. Each life holds promise, even if disadvantaged by developmental disability, injury, disease, or advanced aging. FRC believes that every human life has an inherent dignity, and that it is unethical to deliberately end the life of a suffering person, euthanasia, or assist or enable another person to end their life, which is assisted suicide. True compassion means finding ways to ease suffering and provide care for each person, while maintaining the individual's life and dignity. This path to peaceful dying rests on the illusion that a society can safely put in the hands of physicians the power directly and deliberately to take life, euthanasia, or to assist patients in taking their own life, physician-assisted suicide. It threatens to add still another sad chapter to an already sorry human history of giving one person the liberty to take the life of another. It perpetrates and pushes to an extreme the very ideology of control, the goal of mastering life and death, that created the problems of modern medicine in the first place. Instead of changing the medicine that generates the problem of an intolerable death, which in almost all cases good medicine should do, allowing physicians to kill or provide the means to take one's own life simply treats the symptoms, all the while reinforcing and driving us more deeply into an ideology of control. The Right to Die with Dignity Act is controversial to some, but if you want to end your life, what's the difference between a medically assisted suicide and an overdose? Many people don't see the relation, but in all honesty, to me, it's the exact same. Another instance, what's the difference in between killing yourself and having an abortion? People frown upon killing a child, but it's different for an adult to do the same. We are brought into this world for a reason and a purpose. We all have a calling, and who knows what you can accomplish between the expected time you're supposed to pass. To take a life and throw it away because you're unsure of the future is selfish in a way. If your death is inevitable, why go early? I understand the pain that goes with the terminally ill, but as one may know, they have medications to ease the person's pain and make them as comfortable as possible. If I was in a situation as such, I would want to spend as many days as I could on this earth and live every day to the fullest. In a way, I believe it's selfish and uncalled for to end your own life. In many cases, the death lingers for hours. It's not a dignified death. It's not pretty to watch someone struggle with breathing or having irregular, shallow breathing for hours and hours upon end. Researchers analyzed data from 2 studies of euthanasia and physician-assisted suicides in the Netherlands, with a total of 649 cases. Complications occurred in 7% of cases of assisted suicide, and problems with completion, a longer time than expected for death, failure to induce coma, or induction of coma followed by an awakening of the patient, occurred in 16% of the cases. Complications and problems with completion occurred in 3% and 6% of cases of euthanasia, respectively. The physician decided to administer a lethal medication in 21 of the cases of assisted suicide, 18%, which thus become cases of euthanasia. The reason for this decision included problems with completion in 12 cases and the inability of the patient to take all the medications in 5. Researchers found that there were sometimes clinical problems with the performance of physician-assisted suicide and euthanasia. The problems reported by physicians frequently concerned a longer than expected interval between the administration of the lethal drug or the first drug, if more than one was administered, and the patient's death. There's endless possibilities for medications to make your illness less painful, but no way to restart your life after you're gone. Cherish it. Like Tim McGraw said, live life like you were dying. You shouldn't be living to die, instead dying to live. There's many out there who don't get the option. Love your life. Don't take it for granted and leave sooner than God has planned for you.
Okay.